Hello, everyone, and welcome to the Veterinary Business Podcast, your ultimate resource for developing a successful veterinary practice and career. I'm Dr. Peter Weinstein, one of the co-hosts of the Veterinary Business Podcast. On this podcast, we bring you insights and expertise from industry-leading doctors, experts, thought leaders, and disruptors. We cover a wide range of topics, including practice management, marketing strategy, leadership development, HR best practices, and whatever comes to mind. Whether you're a practicing veterinarian, a practice owner, practice manager, veterinary student, or somebody who's thinking about the veterinary profession every day, this podcast is tailored to help you navigate the unique challenges and opportunities in the business of veterinary medicine. Every listener of this podcast is welcome to visit the www.veterinarybusinessinstitute.com for additional resources and tools to support your growth. And remember, you can subscribe to our podcast on iTunes, Google Play, Spotify, and all of those world-famous popular podcast platforms. Today, I am so excited, emphasize the excited, to talk to Dr. Jeff Sanford and Dr. Rick DeBowes. Our topic today is veterinary business education now more than ever. Let's jump in. But before we get started, let's learn more about our guests. I'm going to go to Jeff first and say, Jeff, you and I have known each other for a few years now. But the rest of the world, you are one of the best kept secrets in Athens, Georgia. Tell people about who you are and what you do.
Thank you very much. I started teaching at the vet school in 2003. And when I started teaching business here, after about 5 years, I said, oh my gosh, basically, they need to know about business. And it was stuck between cardiology and radiology. And basically I said, oh, like surgery, I said, we're going to start a rotation in 2007 that takes students into practices and let them observe the practices for 2-3 days, and then write up a report on all our findings from our observations, as well as the data that we get from their software as in their financial reports. What is exciting is this helps prepare them for their future jobs that they had no understanding of, because they don't know how to look at practices necessarily, except for the medical side. And it helps them also become future owners. Since then, we've visited close to 300 or 400 practices. I've helped students start probably a couple hundred practices or buy into practices since then. So that's what we do here. Now I'm also responsible for all the financial learning that starts in the first year all the way to the 4th year.
And to clarify, you are not a veterinarian.
No, I'm just a business.
Right. And you don't pretend to be a veterinarian.
Nope, no, sir.
So our other guest pretends to be a veterinarian. Now, Rick DeBowes and I go back to Champaign-Urbana, Illinois. He was there a couple of centuries before I was. But I'd like to welcome Dr. Rick DeBowes, who is a veterinarian. And Rick, if you could give us a little bit of an overview of how you got from Champaign-Urbana to Pullman, Washington, that'd be great.
Thanks, Peter. Pleasure to be here. And Oski Wow Wow to you and all the other alumni who are out there. I'm a 76, 79 model, Illinois. And I went there thinking that I'd be a small animal veterinarian. I grew up in a small animal hospital as a kennel assistant through junior high school and much of high school, but I fell in love with horses and left Illinois. And after a very short period of time back in my hometown in a small animal practice, I went to an equine internship, residency, surgery boards, and was an equine surgeon for the first roughly 20 years of my career. I relocated to Washington State from my first 20 years at Kansas State. And when I got to Washington State, they already had 3 times as many surgeons as we had at K-State. They didn't need another equine surgeon. I was a department chair. So I started getting into business classes and leadership classes, built the veterinary leadership experience, built a communication course, And then eventually it became very obvious that the students needed something with finance. We really couldn't resolve that readily working with the business college. So I began to teach a very elementary practice management class. And then I encountered Jeff Sanford in my evolution. I'd been bringing consultants in, but I met Jeff, and Jeff educated me about his rotation, was kind enough to share everything with me. He is the thought leader and developer of that rotation, and we've worked together to try and add pieces in leadership and culture development, organizational culture, things that I had some roots in, and it's a really a fun thing to do. I've added to that a vertically integrated financial literacy course here at Washington State that covers the sort of life stage financial literacy from year one through the end of year three as they enter the clinics. And it's a long way from doing colic surgeries, but I don't do an awful lot of that at 2:00 in the morning. So it's in some ways better than colic surgery.
Yeah, and you don't have to pull your glove up to your shoulder in this class, do you?
No, although there is plenty of anal nitrogenous waste, even in business. It's not as messy.
Yeah, and this too shall pass.
Yes, sir.
So I don't know about you, Rick, when you were at Illinois, but I remember taking an elective, and it was either third or fourth year in business, and it was taught in LAC 80, which was the large animal clinic, dark hole, and it was taught by videotape, and I think it was an 8-week elective with a guy sitting behind a desk in black and white trying to vomit business education to us. And that was the extent of business education in veterinary school back in the dark ages. Did you get any more than that when you were in school?
No, sir. No, sir. In fact, it was interesting that you could sit there in a recovery stall with one or two equine clinicians, or you could be back in the PAR area of anesthesia, waiting for your dog to wake up and be able to extubate him. And at no time did anybody sit there with you and ask the question, what do you think we should charge for what we just did?
Yeah.
What was involved in that? Who was involved in that? What was the space, the time, the materials? We never had those conversations, unfortunately. So we left fat, dumb, and happy.
And most of us haven't changed much since then.
No, sir.
So Jeff, when you started at UGA, did the veterinary school have a business curriculum at all? Were they teaching anything, or did you have to build it from scratch?
Yes, it had a required class for everyone, but it was taught by a guy that was about 80 years old. And the dean said, okay, no one's showing up to her class. Let's bring in someone who understands business and bring them in and teach the class. Of which I found myself. At first I know a lot about business, but I didn't know as much in depth about veterinary medicine. And so I brought in a veterinarian to help me with the class. And that's that. But it really wasn't until I started going into practices regularly in 2007, went from 2 practices to 15 practices with students a year, that I really started getting in deep with what's going on with the practices and my students also. Now, I will tell you this, I've always tried to make mine not about big heads coming in and giving a 2-hour talk and then leaving. I've always invited people who've owned practices to come in. I've always had younger veterinarians come in, talk about their experiences as being a new associate, as well as being new owners. So that the students could see it wasn't this, 40, 50-year-old guy or 60-year-old guy talking about their experiences. It was really relative to them about what is that path to get to from graduating to being a great veterinarian to being a great owner. And that's what I tried to do.
And Rick, when you moved from wherever you were to Kansas State, if I'm not incorrect, Kansas State, and especially with its proximity to hills, had a pretty good business foundation. Wasn't there a guy named Ray Russell who was focused on business at K-State right around the time you were there?
Yeah, there was a gift from Hill's Pet Nutrition to Kansas State University to establish a National Center for Practice Management. And I was not involved in that gift acquisition, but Ray Russell was brought in by a search committee, and he began the process of trying to put a curriculum in place. I did put a hospital director in place when I was the department chair for clinical sciences there at K-State, Dr. Roger Finglin, who brought in also a group from Nebraska. I believe their name was Practice Coach. And they did some educational pieces for our students as well. I think if we were honest with ourselves, I don't know that that National Center for Practice Management bloomed nearly into what it could have been. I think because Ray Russell got it a start, but then after Ray Russell, there wasn't anybody who really seemed to carry it forward from my perspective.
So I go back to the 1999 mega study, the KPMG study that kind of gave the first indication to the veterinary profession that we had a lack of basic business skills and knowledge. And shortly thereafter, the Veterinary Business Management Association was kind of conceived and started through meetings at University of Pennsylvania. And so the students at that point in time were getting a feel for veterinary medicine is more than just spaying cats and deworming dogs. It really had a business need to it. And I think some of that was the relationship with pets and people had become what we now call the human-animal bond. So the business of veterinary medicine was nudged, pushed forward by the VBMA. It was pushed forward by the mega study, but it really wasn't a mandate in the veterinary schools until probably sometime in the 2000s. Correct me if I'm wrong. And has there ever been, or do you guys know if there's anything specific in the directives from the Council of Education regarding business education as part of the four-year curriculum?
So I know that that study in 1999 started our improvement here at UGA. That's what started me teaching. And basically, we sent out a survey, and it confirmed it, that we need basically business education. And so that's what we did. We responded to the survey. And that's what really kind of started culminating everything with this is at the UGA was that.
You know, I would say this is a real compliment, tip of the hat to the students, because this really got out of the blocks when Megan Stalker, who was a veterinary student at Penn, you know, went around looking for a solution to why they didn't know anything about business. And with the help in considerable amount of funding, actually, again, from Hill's Pet Nutrition under the leadership of Dr. Chuck Wayner, they made sizable investments in the VBMA to get it rolling. I don't know the answer to your question specifically. I know that I have looked at the Council on Education's 11 standards for veterinary colleges about, you know, the things you have to do to be accredited. And curriculum is under
number 9, I think, Rick.
Yep, yeah. Number 9. Section F alludes to the fact that there should be some education around economics and practice management, ethical elements, legal elements, etc. As is the case with all of the guidance from the Council on Education, they are not exquisitely prescriptive because they don't want to limit the number of hours or how it's taught or who's teaching it, but they have in broad brush terms said it would be good if they were taught about economics, ethics, law, and practice management.
So I have the opportunity to do some teaching on business and finance at Western University, and I've got a fairly good number of hours of touch points with the veterinary students, all in the third year. Can each of you talk a little bit about your curricula, the time that you get to spend with the different years, and just give a broad brush overview of each of the schools at University of Georgia and Washington State? Go ahead first, Jeff.
Well, it started recently. We started a professional skills platform in every year. So the first year is really built on understanding about money. And the money part is mostly about making sure they have budgets and paying attention to how they spend in school, with the end in mind, right? So we teach them about how to basically debt management on the first year, so they understand what they're kind of getting themselves into. And then that kind of blooms into a little bit more. The second year is more into think about being intentional about what they're learning at their school. And so I always tell my students, make sure, especially the GPs, make sure you know the top 10 things that people are coming into before you graduate, right? Because that's going to set you up a lot better if you know your derm, if you know your vomiting diarrhea, if you know those top 10 things that you can just go into practice pretty quickly and communicate well and do well. That's going to get you up going a lot faster than most others, right? So we do that. I started teaching that a little bit their second year. Their third year goes into right now, it's going to change, but right now that's the third year curriculum on practice management, where they learn how money works in a practice. But I've really geared it toward how to prepare for your first job, because those kind of tie in together. How managed practices and how it works and how well it works, which also defines, the people, the culture, the leadership. We want to make sure that they understand that, so when they get out, they find good examples to go work for, as well as learning about the profit and loss statements and HR issues and marketing issues and those things. But really, what's going to advance that person to find a good practice when they get out and understand what goes on in that practice, they make good decisions, and hopefully, and when they see the opportunity to own their own practices one day. And so the third year is that, and the fourth year is I do 6 3-week blocks with students where we go into practices.
Thanks, Jeff. Rick?
So I have these two classes. One is financial literacy and one is practice management. The practice management is taught to third year students. It's a didactic class. And that runs the gamut of the basic things you'd expect to find in practice management. So we're talking a lot about the landscape of the profession. We talk an awful lot about financial statements. We talk about how money is generated in a practice. We talk about HR. We talk about organizational culture. We talk about inventory management. We talk about what does a well-run practice look like and what could you expect to happen in a well-run practice. So it's very incrementally stepwise, right through a little bit of business law, practice law, pet insurance, and on into contract, a little bit of basics on contracts and negotiation and what an employment document or a letter of interest might look like. That's the practice management one. Obviously, we have a fourth year rotation because Jeff was kind enough to share it with us. And so we do what Jeff does with our rotations. We have 4 2-week rotations, and we do a practice every week with 8 students as we go through that. The financial literacy class, year 1 is focused, again, as Jeff mentioned, on money. Most of them actually don't know the difference between simple and compound interest. So we start off with the basics and the rule of 72, and we talk about the very, very, very basics about how do you grow money, investments, a little bit about mutual funds, things like that. Best time to start retirement was 20 years ago. Next best time is this afternoon. So we're making sure that they're a little bit prepared for the future and that they have a little bit of background, the time value of money, things like that. In the second year, we talk about risk mitigation, protecting yourself, super important, obviously, to be able to transfer risk to insurance companies. So there's a lot about that. So they started off with knowledge of money and budgets and things like that. Now they're understanding how to protect their money. And we talk a lot about career options in the second year, so they don't close their mind to anything. We also have a speaker in on student loans very early on, because of course, once they understand that they're into this about $700,000 or so between the cost of vet school, the cost of their undergrad, and the opportunity cost from the revenue they gave up for 8 years. This is a sizable investment. You want good things to happen, right? So since you're borrowing money, the first thing you should do if you're digging a hole is stop digging. Don't make the hole any bigger than it needs to be. We talk about that early on too. And then when we get into the third year, it's very, very focused on negotiation, what to look for in a place that you think you want to work at, and more about general contracts and negotiation for all the people who are not going to take the practice management class. So because we find out that it's 25 to 35 people take the practice management class, unfortunately, believing that they don't really need to take it unless they want to be a practice owner. And in point of fact, the best reason to take it is so that you can be a well-informed associate and contribute to your employer's business so that it thrives. People don't necessarily look at it that way.
So the unique thing about the two of you, and the thing that got me most excited when I heard about it, wasn't your smiley faces, but was these on-site visits that you do. And I think I heard about it first at one of the AVMA economic fora not that long ago. And I thought, OMG, for you guys that are older, it's oh my God. What a great opportunity to do an externship on business. And so I really want to take a bit of time and have you explain, for the 99.8% of the population that'll listen to this, all 5 of them, what that looks like, and what the experience specifically is for the 8 students that go in on these what I would call a business externship.
Like I said, in 2007, I really wanted students to have a business experience. They'd never had a business experience. They had a bunch of talking heads that came in, but they'd never had gone into a practice and looked at it differently. And so, like a surgery, if you want to learn surgery, you go do surgery, right? If you learn business, well, you don't sit in a classroom, you go to the practice, right? And so that's what I thought the experiential learning. That's what I wanted to do. And so, and that's what I appreciate with Dr. DeBowes. That's what we kind of put together. And what we do is it's called I call it a health check, and that can involve many things. We let it kind of be open to the owners. But overall, what we're going to do is first, we're going to do a financial audit. And we're going to look and see what's going on with the financials. We'll look at all the numbers, do some comparisons. We'll also compare not with just industry benchmarks, which they're kind of getting kind of old now. I actually have a database of practices that I can get and use their numbers to compare real practices with these practices with the same kind of ACT and those sort of things. But we do a financial run, right? Say, okay, what's your cost of goods looking like? What is your payroll looking like? It's looking a lot different, especially in the last 2 years. And what is that overhead looking like? And I try to teach the students you only have a couple levers to pull. You can manipulate revenues, right? I just heard one corporate that's going to raise prices 10% this year. That's how that's manipulated, and students learn about that. And also cost of goods, which is that inventory control, right? Or it could be also low fees. It could be also discounting. It could be stealing. It could be lots of different things. But they learn that it's an indicator to say we need to investigate this if the cost of goods is too high. And then we get into payroll. Payroll, I tell people all the time, a lot of times it's under capacity, sometimes it's over capacity, depending on the percent that you have. But we look at what people are making and what that looks like, as well as the overhead. And then we just gotta move into everybody's got practice management software. I would say 80% of practices, there's something really kind of messed up with it because it's not kept up with. And so a lot of times we're going through their software and looking at their fees and stuff, trying to figure out what's what, a lot of duplications, a lot of just bad fee management, really, to tell you the truth. People don't go through fees at least once or twice a year to make sure everything's right. And so over time, if they don't do that over 10 years or 5 years even, that creates quite a mess. So we go through that, and we actually analyze all the revenues by category. We look at not only that, but we look at things like compliance. I know Rick and I talk about this a lot. We talk about compliance because we want people to be intentional in the exam rooms, or their teams to be intentional with the clientele and the patients, and we find that that's not happening. And so we do compliance reports so they can see exactly what their medicine is, as well as we do retention studies to see how many of those clientele are staying in. We also do production studies to find out what the doctors are producing and what they're producing per hour. I want them to really understand the production piece, because when they're interviewing for their jobs, they need to find out from the practice the revenue is growing, but not only the revenue is growing right now. What's interesting is the invoice trend right now. So I always tell them, look at invoices as well as what the doctors are producing, right? With those two things, revenues and invoices, right? Because if they can figure that out, then they can figure out who they can mentor and whether or not they can make money at that practice. And then I think what's even more important, and what I think a lot of people, all that they love all the financial stuff, but what I think Rick and I think what we'll say is what the doctors and the owners really love are our observations. We usually observe between 20 and 30 appointments. And in those 20 or 30 appointments, the students watch and they have checklists to see what happens and what doesn't happen, right? And we give them a very detailed report on our findings. And that is where they go, oh, and they can find where they're missing the boat with their training, or missing their boat with not having enough people, or just not having the right people in the right places, right? So that's kind of the whole kind of, did I miss anything, Rick? But that's
No,
kind of
I
the whole
I think
thing.
you got it. I think you got the big pieces. We may do some things where we'll make some fake phone calls as well, just to see how people are managed, because most people come to you through the internet or the phone. And we found one practice where the receptionist said no was her favorite word, and she was just turning away clients left and right. So there are interesting things that you discover when you do that. But by and large, I think Jeff has hit the nail on the head, and it's an eye opener for the students, and it's a massive eye opener for an owner with a learner mindset, because they've never had the opportunity. Even if they brought a consultant in, most consultants would look at their operation, but they're not veterinarians usually. Many of them aren't even vet techs. And it's different when you have a fourth year veterinary student who's almost a veterinarian sitting in the room watching a client wonder aloud 4 or 5 times if their dog is overweight. Or, my husband makes fun of my dog and calls him Pudge. Or my girlfriends make fun of me at the dog park because my dog is a pumpkin. And, the veterinarian is not picking up any of those shiny lures that are being cast in front of them by a desperate owner. And I think that's eye-opening to the students, because they see the opportunity to do good medicine.
So you take what, like 8 students into a practice for a week?
Yes.
Is that what it looks like?
For me, it
I
is.
do a week. I do a week and a half.
Okay.
He does a week.
All right. And at the end of it, and at night, you're meeting and you're going over your findings. And you shared with me one of your reports. It looked like Harry Potter 7, about 1,100 pages, but these reports are pretty extensive, aren't they?
Ours are usually around 120 pages.
And how much does it cost the practice for you to come in?
Hotel and some travel and a request to make a donation.
Same thing at Wazoo?
Well, not quite. We have some sponsorship from Zoetis to try and offset some of our costs. They have been reluctant to let me ask veterinarians to pick up the rooms. We have certainly had some grateful practice owners go, wow, number one, I wish this would have been there when I was a student. Number two, let me write you a check for 3 or 5, or one of them $10,000. Please keep this rotation going. So that, like I said, the people with the learner mindset instantly see the value of this.
And I'm assuming you have no trouble in getting students signed up for these electives. They probably fill up pretty quickly, and there are some disappointed bodies.
At Washington State, that's true, because I can only do them through the summer when I'm not teaching didactic classes.
almost all mine filled up.
So obviously, if you had capacity, you could do more. And if you
Absolutely.
had, without sacrificing your own lives from that standpoint. So,
It is a commitment to do this because you're with students fully for that period of time,
right.
day and night at those practices. Some of those practices are 5, 6 hours away, right? So it is a commitment.
I
And
love
Uh,
it.
they are
but
18-hour days. They are 18-hour days.
I loved what you said just a minute ago, Jeff, I believe, or Rick, I'm sorry, that the owners wish that they had these programs when they were in veterinary school.
True.
And I know you guys network with other educators. Are there other schools that have that are attempting to replicate what you're doing? Have you started to share the secret sauce? Um, there are 30 some odd veterinary schools, 35, I believe now, that are accredited. Is it just the two of you who are doing this, or are there some others who are offering it as well?
it's not. I've helped Florida, Auburn, Michigan State, North Carolina State. Did I get them all? Yeah, and Washington State. Start this up. The issue is, as you might know, all these institutions have a shortage of veterinarians, and to put something into a non-veterinary specific role is really hard for a lot of them to get away from, especially if they're younger veterinarians who are being asked to do a lot of things at their institutions, right? But like North Carolina State, I mean, they can do like one or two a year. Florida State, one or two a year. I think Auburn does four a year. I think four a year, and Michigan State does one or two a year. And it's all because it just doesn't have the devoted time and resources to expand the program.
So you really need a train the trainer program, don't you?
Well, and there has to be a dedication from the institution itself to say to this person, this is going to be your full-time job, or at least three-quarters of your job, to do nothing but this type of training.
And I would add that I'm not sure that everybody yet thinks in their curriculum about, Covey. Covey got it down to 7 things. One of them was begin with the end in mind. Are we sitting there as a faculty thinking, where are 85% of these people going, and what will they need to be able to do to succeed out there and thrive, so that they're not populating not one more vet website every evening with tales of woe? And I believe, and this is not a disparaging comment, I believe that if you walked into almost any faculty meeting and said, we have a position that's funded, what would you like? A business person would be the last thing that would ever occur to anybody. It would be a dentist or a dermatologist or an oncologist, or God forbid you could even find a radiologist who would come in. It would not be about business and practice management.
It's funny as you say that, because if I had the money, and I don't, to endow a chair at a university, I would have endowed a chair in business and practice management.
I'm working on it, Dr. Weinstein. I'm working on it.
Well, right now, most schools have endowed a stool in practice management.
No, at UGA, we've received over $250,000 of funding so far.
Good for you. So is it going to be the Jeff Sanford chair?
I don't know. I don't know if I'll be here that long, right? So
maybe a bench. Maybe a bench.
Well, the two of you could sit on the bench together.
It might be porcelain. I don't know.
Have you guys ever considered offering this for cost to veterinarians themselves? These are clinicians who graduated and are interested in becoming more knowledgeable about the business, the real business. Have you ever considered offering it? I know you guys don't have a lot of time, but offering it as a paid program for veterinarians?
Yeah, we've talked about it, and we've talked about the NADC VMX Institute or something like that. And I would tell you that this information, of course, is and this is not to diminish anything that any of us are doing, but this isn't rocket science. As I get to learn more and more about it, it's not. rocket science. Jeff used the word intentional. Again, begin with the end in mind, be intentional about what you're doing, focus on what you're doing. I would tell you culture is the biggest problem in most practices. And I think you could hand everybody the directions to fix their practice, but if they don't address the organizational culture in their practice, it ain't happening.
Yeah.
Dr. Weiss, it's funny because if you look at VMGs, you'd think that you got a group of people. Why are they not going into practices and looking at them like this way, right? And instead, they just look at, oh, how much money did you make, and what's the profit margin on everything? It's not on what's actually happening in the practices in themselves, right? It seems like that would be an easy convert, right? That you could do that. I'm not so sure people want to hear the feedback, but
Well, as you know, I did this for a while, and it's frustrating. It's frustrating as an outsider being able to make a diagnosis on the inside, but not getting the client to actually treat the patient. So I stopped doing consulting because it was like the client with the pet with skin disease that you send home with shampoo, antibiotics, and antihistamines, and you say, give meds twice a day, bathe the dog every other day, and 2 weeks later they bring in a full bottle of shampoo and all the pills are still in the pill vial. You can tell them what the diagnosis is, but they still have to treat it. So the other thing is that the numbers are easy. That's like, well, I'm not going to look at the pet. I'm just going to run a blood sample. And so, yeah, well, here's all the lab work. Well, what's the cause? Just why is there anemia? Why are the kidney values out of whack? And so it's, as an accountant, I can look at a profit and loss and say what's abnormal, assuming I actually have benchmarks to look at. But the real issue as a clinician is diagnosing the cause for the abnormalities. And I think even as clinicians, we sometimes teach to the test and not teach to doing the physical exam. What you are advocating for is a history and physical examination, and then using the data and the history and physical examination to make an assessment and set up a treatment plan. Correct me if I'm wrong.
You're exactly right. That's a great way of putting it.
Yeah, the P&L is a chem screen for the business.
Right. Right. And this is how we have to present it to veterinarians, is because in many cases, veterinarians are really good at looking numbers and saying my practice is sick, but they don't look at what's causing it to be sick. In other words, they don't look in the mirror and try to figure out where the problems are. So we have a short window today before we have to end, and we're going to do a second part to this conversation. But what I want you guys to address in the next few minutes is the benefit long-term, some of the stories of the impact on your course on the students. Let's just focus on the student impact and some success stories of your students who've been through your curriculum.
I'll give you the short version. Jeff has a much deeper well to dig into since he pioneered this. The story that I hear, and I've been doing this regularly since 2015 with Jeff's help and teaching. The story that I hear is students will come up to me at the end of 2 weeks where we have analyzed 2 hospitals, which are always different, but always the same, and that there are some common threads that are pretty well woven through the profession. They'll look at me and they'll say, thank you. My level of anxiety has gone way down based on watching these people work the way they work and leave so many opportunities on the table and still succeed. I now know I cannot fail in a general practice. I cannot fail. You can see the angst run out of the group. They're so excited with what they could do. And what does that look like? That looks like a new graduate sending me a text, and I get these. This is my phone every June and July and August. Hey, wow! In the new job, hit production my first month. Hit production my first month. Hit production my first month. And then I had one student write and say, I generated $923,000 my first year out of veterinary school. Now that's some pretty strong revenue generation, right? And I know Jeff has had these people too, and he should speak more to it. But the thing I'm focused on in a profession that is struggling with wellness is these people are happy and fulfilled, they're financially successful, but their anxiety level is coming down because they see, you know what, it's about doing the common things uncommonly well. And all they need to do is put a preferred pathway to health together for those 10 things that are 80% of their business, and they'll crush it. It's just what Jeff said before. Do you know skin? Do you know diarrhea? Do you know the basics? So that's from my perspective. Jeff, I know you've got a lot more people.
Oh, yeah, I mean, Rick, you nailed it on the head. I mean, basically what I want to do is make the students, because they don't have a whole lot of experience except for maybe being a technician for a little bit, is to lower their anxiety and really know what they're getting themselves into. It's kind of like gymnasts, right? You kind of go, if you look at Olympians, they go training, and then when they finish their Olympics, they don't know what to do. And I kind of equate that with also veterinarians. When they get through all this training, they get out and they have huge imposter syndromes, right? And so they have anxieties. And yeah, I think that's what our job is to help them with that transition a little bit. And I love it when I hear not only that, to begin with, we do a lot of contract negotiations. So I love it when I hear students that get $20,000-$30,000 more out of their contracts than they would have before. And also making sure that they're not taking advantage of, like with negative accrual and PTO, right? I never understood those two concepts where you offer PTO, but you have to do negative accrual on their vacation. That doesn't make sense, right? So they understand those things as well. So they feel better about negotiating and talking to people a lot of times because they understand what ACT is, they understand what invoices are, they understand what production is, so they know what to ask when they're on their interviews. And then to move on, it's just like what Rick said, is I love hearing students getting their first jobs and they're hitting, $50,000, $60,000 a month really quick, right? And they're earning their, and then after a year or two, when they get their emotional intelligence kind of really running really good, then they're doing 800, 900 million. I've had 4 students who called me in the last year that said I hit 1.2. Right? One got laparoscopic surgery, and all of them would say, if you ask them what was one of their best rotations, they'll always come back and say the practice management rotation, because I learned how to do things. And I got to observe what was going on in a practice in a way that I didn't know. The problem is that at our institution, it's a bunch of specialists, and all the specialists see a bunch of special work. They don't do GP work, right? And so that's what this rotation helps them with, is that GP work. I really try to give them a road to that. And then probably my most fulfilling thing is when I have people who start practices or buy practices, and they tell them, I give me notes, and Rick gets this too. Thank you for fulfilling my dreams. And I just had one of my students who just sold his practice for $20 million after 6 years. Right. And so, I mean, at 38, he is set for life. And it's all because he'll say the foundation was started at our practice management course and our rotations at UGA. And that's not only that, but there's dozens and dozens and dozens of people who have their lives fulfilled, either being a great associate or being a great owner. And that's that to me, that is great. If they can have a fruitful life and in this profession, that's great. There's nothing more that hurts me is when I hear someone call me up and says, I'm done, I'm out, I don't like the profession anymore, I'm going to become a travel agent.
That is a great way to wrap up this part of the conversation. I look forward to doing this again, and I want to talk a little bit more about the impact on the students, but I really want to talk about some of your common findings on some of your site visits when we get together at another time. Gentlemen, thank you so much for your time today and sharing veterinary business education. And I like to say now more than ever, especially with the economics of the veterinary profession. First of all, let me thank you for what you're doing to help make the next generation of veterinary students better. It makes me want to go back to class. Can I come sit in with you, Jeff, sometime in Athens? So
I'd love to. I'd love to be still on the rotations too.
Yeah, we'll got to work that out. Anyhow, we appreciate it very much that you joined us on the podcast. I want to take a moment to thank our listeners. We appreciate each and every one of you. We can't do this without you, our listeners. If you like our podcast, kindly share it with your colleagues and friends on all the different social media platforms. And also don't forget to leave us a review on your favorite podcast platform. Your reviews help us and help other doctors, practice owners, etc. find us. Great chat today, guys. Thank you so much. And thanks again to all of our listeners.